My name is Sommer Bazuro, and I'm the Chief Medical Officer of the IPG Health Network. Here to talk to us about the lack of diversity in clinical trials and the cost to society as a result is Dr. Koh. Dr. Koh, thank you for joining us today. Do you know of any best practices for diversifying clinical trials, Dr. Koh?
Well, the first and most important practice is actually to have a clinician ask a patient if they might have interest in a clinical trial. It is surprising how often patients are not offered participation in a clinical trial, especially for the underrepresented populations, perhaps due to ingrained implicit bias. For example, in 2022, a study was published that looked at Black women with metastatic breast cancer. Just 40% said they had been offered a trial, but when interviewed by researchers afterwards, 80% had said they would have considered a clinical trial if they had been offered that. So, number one is just ask. In fact, ASCO and ACCC have teamed up on a Just Ask project to get practices to do just that, to open the conversations with patients on clinical trials. The other part of it is, how do we make clinical trials more accessible? Clinical trials are often associated with a variety of scans and tests. Many patients face challenges with transportations, multiple visits, multiple scans. This is a particular challenge not just for underrepresented patients, but for those who live in rural areas. The FDA has recently released draft guidance on decentralized trials and includes a number of strategies that can be used to improve accessibility to trials. This includes employing telehealth, remote visits, and allowing, where appropriate, for patients to get their labs and imaging done closer to where they live.
You discussed a lot of the things that we have identified over the years that helps. Utilizing technology such as wearables can help you overcome some of those logistics. Wearables can collect data in real time and long-term data from patients and can help overcome some of the logistics that those rural patients might face, for example, in terms of getting to a health center. Have you seen any other initiatives or outreach efforts that have been particularly successful?
The NCCN just completed its annual conference, and there was a fascinating study of how we can improve inclusiveness if we bring these trials or approaches to where the patients are at. So this was a presentation by an inner city hospital that looked at colorectal cancer screening with stool blood testing. They compared a setup where they encouraged patients who came into the hospital to get colorectal cancer screening. Only about 25% of people who came into the hospital actually signed up to get this testing. In contrast, they actually went out to the communities, to places of worship, to community centers, and created that same exact setting where they encouraged people to get testing. And the uptake there was over 75%. Again, attesting to like when people feel comfortable, when they feel supported by family and friends, when they go to environments where they trust the individuals, they can be much more comfortable about receiving healthcare and likewise to participate in trials. So, in your viewpoint and experience, what would you say to anyone who thinks that diversity in clinical trials will be expensive and slow down research?
According to data published by the National Academy of Sciences in 2020, the opposite is in fact true. So, this was an economic analysis called the Future Elderly Model, which measured three things. It measured life expectancy, disability-free life, and years in the labor force. The analysis showed that without adequate representation in clinical trials, the amount of life expectancy, disability-free life, and years in the labor force that Black and Hispanic Americans lose equates to hundreds of billions of dollars. So it actually costs us more to have a lack of diversity in clinical trials because underrepresented groups are left to get sicker and therefore are less able to contribute to our economy. There's an additional study conducted by Dr. Marcella Alson's group at Harvard that showed that physicians who treat Black patients, for example, are less likely to prescribe medicines that were approved with inadequate representation, and that their Black patients are less likely to take those medicines even when prescribed. This has a direct impact on the clinical trial sponsor's financial bottom line. So the opposite is true when you actually look at the data. As far as slowing down research, better representation doesn't slow down clinical research. A lack of representation, however, slows down innovation and the rate at which we make important new discoveries.
Wonderful insights, Summer. Your comment actually triggered a couple of additional thoughts. I think it is too simplistic to look at cost as only an upfront measure. I think it is much more important to look at costs on a holistic basis because inclusion of diverse populations in clinical trials will ultimately benefit society and reduce costs in terms of better health, longer survival, and greater return to productivity of patients who are doing well. And by including diverse populations, we can give the best treatment or we can give the correct treatment to the right patient at the right time and truly personalized medicine for each of them.
Thank you so much, Dr. Koh, for taking the time to speak with us and share your brilliant insights. Thank you to our viewers. Like and subscribe to watch more of our clinical equality sessions featuring academics and clinicians working to create change. Together, we can make clinical trials worth more. Join us. Visit clinicalequality.com.